challenges are workforce, and the challenges are an aging population. With that latter is creating much more multimorbidity and requirement for healthcare. It's also a challenge in terms of finding the enough healthcare workers to provide services. The solutions are going to be, for example, in primary care, I think AI is enormous potential in primary care, but also in healthcare generally, because people will be able to do their own consultations, and the evidence is it could be as effective as a face-to-face with a clinician. So that's very important. The digital developments are hugely important as well. Self-monitoring, health monitoring, which can be done on the individual, as we do, for instance, with diabetes and things like that. But we'll soon all have an implanted chip, I envisage, and it'll all be monitored automatically. So the digitization. The other issue is the need to maintain functional capability of the population, and that is going to be by a much more coherent and encouraging support for people in relation to lifestyle, maintaining fitness, so that we're actually compressing the period of morbidity, of doubted decrease in function, which happens towards the end of people's lives. I'm relatively optimistic. I think part of the real challenge is the sclerotic approach healthcare systems have had historically to change. And if there's a much more agile approach taken and much more self-management of health and self-responsibility for health, then we'll get through this situation much better.